Good morning, good afternoon, good evening to you wherever you may be in the world, and welcome to the fourth and the final of the plenary sessions from the Prince Mahidol Award Conference, titled "Protecting and Improving Human and Planetary Health: A Syndemic View." As I said, this is the last of the sessions before we move on to our conclusions, and it's the one where we want to bring together what we have heard so far from all of the previous discussions that have taken place over webinars over many months, and the plenary sessions which have explored the depths of COVID-19 as a pandemic issue, and to take a broader view. The title of this webinar can also be summed up as COVID-19 is not a pandemic. It's bigger than that. It's a syndemic, to quote Richard Horton. And this seminar, this plenary session, will be exploring the many different ways in which COVID-19 both causes a diverse set of impacts on global health, and also by taking a broader view to addressing COVID-19, we have the opportunity to build back better and to strengthen public health systems and societal systems, both to prevent future pandemics, but also to give us a new vision of global health into the future. So I'm pleased to say that this webinar is organized by the Swedish Institute for Global Health Transformation, SITE, with support from the Swedish Ministry of Foreign Affairs and with a range of international collaborators. My name is Dermot Campbell-Lendrum. I'm the head of the Climate Change and Health Unit at the World Health Organization here in Geneva. And over the next 90 minutes, we'll be engaging with a panel of really stellar panelists from a diverse range of experiences to explore that issue of COVID-19 as a syndemic. So we have panelists who range from advisors to international and heads of government on global health. We have people with amazing experience in global health and child health. We have representatives of the private sector. We have representatives of youth and engagement with some of the big challenges of our time, including climate change and environmental degradation. So I hope you'll agree with me that we really have a fantastic basis for that discussion. We'd also like this to be ideally the most interactive session that we've had so far. So you have the ability to, throughout the webinar, throughout the session, to post your questions in the Q&A, and we've allowed time in the program for the panelists to deal with those questions, to respond to you. I should also note that the session is being recorded, so I guess that's a warning for us just to be careful what we say, but also the opportunity for people to reconnect afterwards if for those of you who are not able to join the session live. And just before introducing the panelists engaging in the discussion in more detail, I want to just say a few words about our own view of this issue from the World Health Organization, and what we understand by this issue of COVID-19 as a syndemic. Obviously, most of what you hear from the World Health Organization on COVID-19 is dealing with this issue as a pandemic. Right from the start, we've been talking about the spread of the disease, the public health measures that need to be put into place to control the disease, and now on to issues about ensuring access to vaccines as these fantastic tools have come online. But throughout that period as well, right from the early stages of the transmission of COVID-19, we have also been highlighting these broader syndemic effects. And if you want an illustration of what we understand by COVID-19 as a syndemic, we can look at what is happening within those countries which have been have suffered some of the highest rates of impact of COVID-19 in terms of morbidity and mortality. In Europe and North America, where the impact of the disease itself has been devastating, but the secondary impacts on strain on public health services have been, if anything, as large as the direct impacts of the disease itself. And they also impact on broader societal determinants of health as well. So huge debates taking place as to whether children need to be kept in school in order to for them to continue their education, avoid mental health impacts, and avoid damaging their life chances, all at the same time as these societies are trying to deal with very high rates of the disease itself. You can also look at countries which have in fact done very well in terms of controlling transmission of the disease. A colleague was pointing out to me this morning the headlines from Western Australia, where they've just locked down in Perth just through a couple of cases of COVID-19, but at the same time are being hit by wildfires, which are almost certainly being exacerbated by climate change. And so the syndemic means that they're having to deal with multiple public health problems all at the same time. You can also look at countries which are poorer countries, which have done a fantastic job of controlling COVID-19. Some of the Pacific Island nations who have managed to restrict their numbers of cases to very, very low levels. But at the same time, they're having to think about what they do to mediate the economic damage that has come from having their tourism industry destroyed, and therefore setting back the life chances of their populations and the impacts on global health that will have as well. And then the poorest countries in the world, which again, many of them have done a very good job of controlling COVID-19 as a disease, but are now having to struggle with the equity issues of finding it difficult to see a path out of COVID-19 if they don't have some equitable access to the vaccines, which are the route out for countries in the world which are richer. So that's how we see COVID-19 as a syndemic, as a problem. But we also see COVID-19, the syndemic, as a reason to rethink the solutions that we need to apply, both in order to prevent the next pandemic. So we need to be thinking much more systematically about connecting COVID-19, not just as a health security issue, but thinking about that in terms of the provision of universal health coverage, because weaknesses in health systems are leaving our populations exposed both to COVID-19 and to those other effects that I've been talking about. But also we need to think about how we connect that discussion up to the determinants of health, the environmental and social determinants of health that determine how vulnerable we are to the next pandemic or to these other impacts that we're having to deal with. So those are the kinds of ideas that we'll be exploring in the session today. From our own point of view, again, as the World Health Organization, from quite early on in this in this crisis, we have been pointing out those syndemic effects and the need to take a different approach. In May of this year, so relatively early on, WHO published a manifesto for a healthy and green recovery from COVID-19, which was already looking forward and pointing out that the massive investments that countries around the world are having to make in order to respond to COVID-19 are also a fantastic opportunity to do things differently, to build a better future for health and to reduce our risk further down the line. So our manifesto that we published has 6 prescriptions for a healthy recovery from COVID-19, from basic ones, including number 1, protecting nature, because that's the ultimate source of all human health and well-being, investing in basic services like the provision of energy and water and sanitation to healthcare facilities. It talks about building livable cities. It talks about sustainable and healthy food systems. It also talks about the transition which needs to be made to a clean energy system. And finally, it talks about the fact that many of the economic incentives that we currently have in place act counter to health. So we're currently, for example, providing massive subsidies to fossil fuel consumption, which is both driving air pollution and also driving the climate crisis. And as I said, I think we have a truly excellent panel to discuss the broad range of ramifications of this issue. So I'll introduce them one by one, and then we'll turn over to the panel to actually engage in the discussion. The format of the session will be a short 3-4 minute intervention from each of the panelists, and then we'll come back for a Q&A discussion. So right from the start, I'd like to encourage you to already start posting your questions in the Q&A. So we'll take that in one round, first looking at COVID-19 as the syndemic, as the problem, the wide range of effects that it has. Then we'll have the Q&A, and then we'll come back for a second round from the panelists, where we'll be looking at solutions to this. So what approaches do we have? What have we learned from COVID-19 that will allow us to approach this in a more systemic solution approach? So the panelists that we have today, we have Dr. Mandeep Dhaliwal, who is the director of the health group at the UNDP Bureau for Policy and Programme Support. Mandeep has many years, over 25 years of experience working on HIV, health, human rights, and evidence-based policy and programming in low and middle income countries. And of course, coming from UNDP, she has that broad developmental perspective as well as the specific public health perspective. So with that, I will turn to the panel, and we'll kick off with Mandeep. Mandeep, over to you to talk about how you see COVID-19 as a syndemic and the various range of impacts that has on planetary and human health. Mandeep, you have the floor.
Thank you, Dermot, and thank you, colleagues, and good morning, good afternoon, good evening to everybody. It's a pleasure to be here with you today, and I'm going to, as Dermot said, provide basically a development perspective and this on the syndemic approach to COVID. So we know that COVID is both a health crisis and a development crisis. Not only has the virus taken the lives of 2 million people, it has also destroyed livelihoods, crippled health systems, locked children and teachers out of classrooms, and is costing the world economy $9 trillion over 2 years, the equivalent of 400 million jobs. We project for the first time in 30 years, global human development progress is going backwards. We've calculated that by the end of the decade, 1 billion people will be living in poverty. A quarter of those, 250 million, will be people pushed into poverty as a direct consequence of the COVID pandemic. As the 2020 Human Development Report makes clear, COVID-19 is just the latest in a string of consequences resulting from the pressures we are putting on the planet in the name of progress. The reality is that in the Anthropocene, the age of humans, and in it, the humanity is actually waging war on itself and the planet. Inequality is both a cause and consequence of the planetary imbalances, and it stands in the way of many solutions. While the pandemic has touched us all, its impact is being felt differently depending on who we are, where we live, how much money and power we have. Existing and growing inequalities have meant that around the world, those who already have the least have been hurt the most. Poor people, women, marginalized people, day laborers, informal workers, those in unstable employment have all faced disproportionate hardship. For instance, in some countries, the pandemic has erased decades of progress in women's labor force participation. COVID-19 has also shown the fragility of health and social systems. In reality, the syndemic approach is important because it underlines how interconnected we all are. The planet and societies are intertwined, and both are flashing red. Unless we address underlying inequalities and find new ways of growing freedom and opportunities for all people, we will see more disruption, pandemics, more extreme weather, and increasing instability. There is still an opportunity to transform our societies and economies so that people and planet thrive together using planetary health approaches. These kinds of integrated approaches also require multi-sectoral governance on exactly what the health community has been calling for years to address the determinants of health. So understanding COVID-19 as a syndemic can help us to respond to the multidimensional nature and impacts and threats of not just the pandemic, but also the threats to planetary health and the determinants of health. So, and I'll say a little bit more about, I think, the potential for solutions from planetary health and that discipline when we talk a little bit more about solutions. But I'll stop there just to say that I think the interconnected and multidimensional challenges and risks that we've understood using a syndemic approach are really critical. And the blueprint provided by the 2030 Agenda, the SDGs, and the pledge to leave no one behind is a really important part of the solution. And I'll stop there, and I look forward to hearing from fellow panelists and to the questions in the Q&A. Thank you, Dermot.
Thanks very much, Mandeep, for kicking us off so well. And as you say, pointing this out as not just a health crisis, but a development crisis as well. And for also starting to point us towards the solutions, which we'll come back to in the second half of the discussion. We also have Dr. Jamila Mahmood, also a qualified medical professional. She's also the special advisor on health or public health to the Prime Minister of Malaysia. So, of course, is well used now to providing guidance, not just on individual health issues, but dealing with decision makers that have to take many different decisions at once, balancing or integrating public health with many other concerns. And prior to this, Jamila has served as Undersecretary General for Partnerships in the IFRC, the International Federation of Red Cross and Red Crescent Societies. So with that, I'd like to turn over to Jamila, please. Jamila, you have the floor.
Thank you very much, Dermot. First of all, let me start by saying that today, more than 104 million people have been diagnosed to have COVID-19, and more than 2.25 million, almost 2.25 million have passed away. So, we're behind all the numbers that we can spew out. I always reflect and say there are human stories behind all of this. There are people who've lost family members and so forth. And we as the humans and leaders in the world, we need to reflect on how did we get here. And I think Mandeep has really set us out on a really great discussion. So from the perspective of someone now sitting in a government position, we see firsthand the impact on society, on families, on education, on livelihoods. We also see the overwhelming stresses in health systems as well. But we have got here not by chance. We have not been surprised, because we all knew it was a question of when and not a question of if. Yet we always feel that we are unprepared. So I think this is the first question we need to, tell ourselves, or rather that in the age of Anthropocene, we have, as human beings, really impacted the planet, and we're changing, how health is evolving as more environmental degradation is having taken place, and how we've also violated our planetary boundaries, which is very clear, developed by the Stockholm Resilience Center, the 9 parameters that we talk about. But I want to switch a little bit to about, how do we look at this moving forward from an economic point of view as well? I think it was very striking when Jacinta Ardern of New Zealand mentioned that, we're not looking at growth in GDP. We're looking at really making sure our people are safe, that, our economy will thrive enough for its people. And I think this is a big question now that many people are asking: is GDP enough as a measurement of economic growth? And I would argue that, as a big fan of Kate Raworth, who wrote The Donut Economics, I think we all have to think about what is it that we want to see moving forward, post-pandemic. What does that growth look like? So some of the things that we may have to think about is reconsidering how we might want to look at the development of a nation, or what investments we're doing. How do we not just become green, but also take into account not just this generation, but the future generation. Living in Malaysia, which is a middle income country, we are also affected by climate change. So as we speak now, there are floods around my country, and therefore the syndemic is not just the economic, the socio-economic, but it's also the impacts of climate change. So there are many things that we can do. And I think one of the things we have to look at is what are the things that are being done around the world that are really inspiring. And I would say Amsterdam embracing the donut economic model and becoming a donut city that looks at growth of the city, not just from the perspective of urban development, but also being sustainable, being kind to the planet. So these are some of the things that we need to be looking at. From a health perspective, at the moment in Malaysia, the Prime Minister has said the health must be a priority moving forward, and that he needs to see some reform going, after, as a result of the COVID-19 pandemic. And I think in one way, it's been a huge opportunity for us to relook at what we've done, what systems we have, and what might be a better system fit for that future that we're going to face. And we all know that we will face more pandemics in the future. So the earlier interventions by the previous panels, I think all that will come into play. How do we become more digital? How do we become more technology enabled? How do we look at universal health and so on and so forth? So I'll pause here, Damit, and we can pick up the conversation later. But thank you.
Wonderful. Thank you very much, Jamila, for all of those comments. And if I was just to pick out a couple, one, thank you for once again putting the human face back on those numbers of the impact, and also raising these bigger questions about whether GDP is enough. I think in the run up to the pandemic, the assumption was, and shown in the indices of preparedness, that the richer countries would be a better place to deal with this. That hasn't necessarily been borne out, which suggests that GDP is not enough even to tell us what we need to do to prevent pandemics. And just finally, I'd just like to compliment you on your background as well. It was, if I'm right, it's a scene from Star Wars. We talk about a planetary health perspective. You're the first to actually take it a step higher and go for an interplanetary perspective. That really is the big view. We also have Dr. Professor Zulfikar Bhutta. He is the founding director of the Institute for Global Health and Development at Aga Khan University, co-director of the SickKids Center for Global Child Health in Toronto, and also recently the commissioner and co-chair of the Lancet Site Commission on Peaceful Societies Through Health and Gender Equity. So he's basically one of the leading global voices, particularly for child health around the world. I'll pass over now to Zulfi, please, for the next intervention. Zulfi, you have the floor. Thank you.
Thank you, Dermot, and I hope you can see my slides. So what I'm going to try and do over the next few minutes is to build on what my worthy colleagues have already suggested as to what has really happened, particularly to women and children in the context of the COVID-19 pandemic. I was reflecting on it this morning. These are data from just an hour or so ago on where we are. And if you look at how the world stands about a year after the pandemic started, to have 2.2 million deaths worldwide, virtually spanning the entire globe, was something that no one could have imagined. But children and women who were in the crosswires from the very outset of this pandemic have largely been some of the silent people, because a lot of the focus has been on the deaths and on the severe morbidity, hospitalizations in the elderly. And the fact remains that for good reasons, the COVID-19 infections in children is generally mild and with negligible mortality. And although there are reports of severe inflammation and some problems in adolescents and those with comorbid conditions, overall, by and large, we are looking at very low case fatality rates in children. And that's been one of the reasons why COVID-19 in pediatric population did not receive as much attention earlier on as it ought to have. As time has progressed, even our thinking around this in terms of subpopulations and particularly morbidity and outcomes in low and middle income countries is changing. But that's not what I'm going to focus on. I want to talk a little bit about the indirect effects of COVID-19 strategies, control mitigation strategies, and how they outweigh the direct effects in children, especially amongst the poorest of the poor. To take this argument a bit further, I'd like to share with you an example from South Asia, where over the last many months, we've been working closely with UNICEF on not looking at modeled data, but looking at actual information from health information systems to give us a sense of what's been happening on the ground in one of the largest population clusters in the world, reasonably homogeneous in terms of types of populations and where they live. And our inquiry has yielded some very alarming results. So firstly, in terms of cases, a lot of diversity in the region, but you could see the region has had its own fair share of cases. And certainly in the last few months, there has been the second wave that has affected every country. And those even who had flattened the curves pretty earlier on have had to contend with increase in rates and numbers. And this has also been accompanied by a pretty dramatic imposition of mitigation strategies such as closures of businesses, schools, lockdowns fairly early on. So if you look at this graphic, you will find that towards the beginning of the pandemic, around March and April, you had almost universal imposition of those measures in the region. And some with very, very draconian effects very earlier on, with just people being forced to move from urban to rural populations because everything closed down. And over time, things have opened. Schools, that I will speak briefly about, have been quite problematic to open, and many countries have had varied responses to opening of schools, particularly for young children. So as we stand today, there are some which have got back to normal, like Afghanistan, and others where people are still struggling to get some sectors of the economy up to speed, and particularly education sector is still not there where it was even just a year ago. Now, the lockdowns or the mitigation strategies can have a range of impact on outcomes, and I don't have time to go through everything, but just taking this from a holistic perspective, it's not just the limitation in health services, the fact that immunization services were just paralyzed for several weeks to months, but also things that relate to disruption in food supplies, food insecurity, indirect effects of reduced purchasing power in households, and disruptions in education. And I'm going to particularly focus on the disruption of education for young girls, adolescent girls in particular. So what are our estimates from direct assessment of impacts in health systems, in information systems, and on outcomes that we know about? So we now recognize that in 2020 alone, in the region, we've had over 230,000 access child deaths under 5 years of age. So 14% increase over what the figures were in the year 2019. And of this, a large proportion would be in the newborn period. Stillbirths, that are related to care in pregnancy and care during childbirth, up also by 10%. And on maternal mortality, you would see an almost homologous impact on maternal adverse outcomes, also including unintended pregnancies because reproductive health services were paralyzed, and a significant increase in unsafe abortions in that space. But these do not capture the impact on morbidity, long-term outcomes such as increase in malnutrition rates, mental health consequences that people have had and children have had because they've been locked down at home, and also importantly, the rise in domestic abuse and gender-based violence. So all of these are signals that this has had quite a significant impact at a societal level. On education, as I said, over 400 million children in South Asia have been out of school since last March. And of those, only a very small proportion can be reached by remote learning. So this bit about distance learning or internet-based education session does not reach the vast majority of children who have neither access nor any chance of an access because they live in situations where they neither have the technology nor the means to purchase technology like bandwidths and data systems. There is also this critical window of opportunity because for many young children, preschoolers, early child development, that early critical period is very much time dependent. You can't just take a year off a child's life where there's been no education and just been thrown open to impacts of family-based education and expect that the child will catch up. So this has been quite substantial. And it has been topped up also by our estimates that close to around 9 million children will likely just drop out of school. And over time, if you look at the compound economic impact of that, you're talking about billions of dollars over the next few decades. On girls in particular, the dropping out of school for adolescent girls almost inevitably in that region means that they will end up by being married off or dropping out of schools permanently. We estimate that in this year alone, there have been 400,000 adolescent pregnancies, which are up from the general figure recognized for that region. And these are all associated with adverse outcomes. And you see the distribution of these across the countries that we studied in the region, South Asia, and even countries like Sri Lanka have not been spared the impact of something like this over time. The lifetime impact of something like this for a child losing her childhood, children having children, cannot be overstated. And this is something that the region has got to keep an eye on because we need to be putting measures in terms of addressing this now, even though the pandemic is still ongoing. So let me finish by saying that these doom and gloom figures really point out the solutions to us. And we should absolutely recognize that in the midst of a crisis like there also is enormous opportunities. The opportunities here are, number one, to keep equity in our focus, and whether we implement the strategies around universal health coverage or reaching every child with education strategies or rebuilding our education systems, you've got to focus on the poorest of the poor. And reducing some of that equity gap has got to be absolutely the focus as we rebuild not only safer, humane, but also more equitable systems, entirely related to our quest for building back better, much better than we had before. Because had we invested in some of these equitable strategies, we may not have faced the brunt of the pandemic the way that we have. Thank you very much. I hope to come back a bit later.
Thank you very much, Sophie. That's fantastic. It's, we've been talking, I think, in powerful but maybe slightly abstract terms about these impacts, and you're presenting the hard data for particularly for women, for girls, children and girls in South Asia. I think really brings it home. These are not modeled impacts. These are real systemic impacts. We also have Monica Puri. She is the head of institutional relations at Roche. She also wears another hat as the global ambassador for the G20 Health and Development Partnership. She's a member of the B20 Italy Task Force on Health and Life Sciences, and like much of our panel, a medical doctor and a trained public health specialist. So with that, I'd like to turn over to Monica Puri, please. Monica, you have the floor.
My panelists have talked about different aspects of this syndemic, but I would really like to bring back the focus on health here, because we all know that COVID-19 has upended the life across the world, causing devastating human loss and pain for families. With vaccines, there is hope that we will be able to chart a course to recovery, but it will take a lot more than that to undo the damage the pandemic has already caused. As a representative of the industry, we are acutely aware of our own responsibility to bring safe and effective tools against COVID-19. And this past year, we have outpaced ourselves in the fight against the deadly pandemic. But at the same time, we have continued to deliver on our commitment to ensure continuity of supply for other disease areas as well. We should not forget other slow-growing tsunamis. Prior to the pandemic, the non-communicable diseases, which means diabetes, hypertension, cardiovascular diseases, stroke, and cancer, represented the leading cause of death worldwide, killing 41 million people each year, which is equivalent to 71% of deaths globally. And NCD services were already suffering from serious underinvestment. Non-communicable diseases remain the largest, most internationally underfunded public health issue, where most lives could be saved or improved. And COVID-19 has only strengthened the case for universal health coverage and making it reality by end of this decade. But we might be staring off course, because the reality is that the vast majority of countries are not on the track to meet the 2025 target for non-communicable diseases to prevent mortality. And let's not forget the 2030 target of SDG 3 goal on health. COVID-19 has also exposed the real damage that neglecting non-communicable diseases and cutting public health spending on health, including health workforce, has done to countries over many years. Primary healthcare workers, who are the backbone of the routine NCD responses, have been particularly stretched during the pandemic and challenging NCD programs. This has created a void in which other debilitating diseases are left undiagnosed and untreated. There have been widespread disruptions in routine health services, screening, diagnosis, treatment, and palliative care for the non-communicable diseases. And according to WHO survey, 75% of the countries have reported that NCD-related services were partially or completely disrupted in May 2020, with low-income countries being hit hardest. And 42% of the countries surveyed partially or completely disrupted services for cancer, with 50% of countries reported to have postponed screening programs. With COVID-19, the fears of these people have already risen. There have been delays in treatment that could lead to more advanced diseases, risking recovery and survival. Countering the syndemic nature of COVID-19 means taking a synergistic approach to protect the health of patients, no matter where they live. We must look at funding, we must look at skilling the workforce, at designing healthcare systems to put patients back at the center of healthcare. If we are to make substantial progress on our common pledge to leave no one behind and provide universal health coverage, we need to reimagine public-private partnerships and work towards making healthcare systems more resilient around the globe. We are at a tipping point where countries are beginning to understand that health needs to be brought at the center of economic recovery. It also means including greater disease awareness, increased availability of medical products, well-trained health workforce, and sufficient funding and reimbursement schemes to prevent patients from suffering financial hardship. COVID-19 has taught us that collaboration is indispensable. The private sector, governments, and international organizations share the same goal, which is also my personal priority, bringing innovation to those who need it the most, making a real difference. And UHC cannot be put to one side for now while we handle COVID-19. Making sure the syndemic nature of COVID-19 is addressed has also been acknowledged at the highest level at G20 and G7 level. Digital health has been acknowledged as an area for more collaborative work with the private sector. The B20 Italy Task Force for Health and Life Sciences, which I'm also part of, is also tackling digital health as an opportunity to shift from traditional episodic model of care to one that is continuous and connected. These are my few thoughts to reinforce that a synergistic approach is needed to overcome the syndemic nature of the COVID-19 crisis. And I'm happy to answer how and look at the solutions and delivering on that. Thank you.
Fantastic. Thanks very much, Monica. I think that that angle is essential. And I was also struck by your line about innovation. That we need innovation, and the medical innovation around COVID-19 has been phenomenal, particularly around the speed of development of a vaccine. But that on its own is not enough without that partnership approach between the private sector and the public sector, and having the mission of what these advances in technology should be achieving and how they need to be governed in order to achieve that. So thank you very much for that. And then finally on the panel, we have Elizabeth Watuti. She's a Kenyan environment and climate activist and founder of the Green Generation Initiative, which nurtures young people to love nature and be environmentally conscious at a young age. In 2019, she was awarded the Africa Green Person of the Year Award by the 11-11-12 Foundation, and she was named as one of the 100 most influential young Africans by the Africa Youth Awards. So I hope you'll agree with me that this is a terrific group of people to kick off our discussions on this issue today. I'll just make that final reminder to please already be posting your questions in the Q&A. We have one final intervention in this part of the program before taking a short Q&A and then coming back again. So with that, it's my pleasure to hand over to Elizabeth, please. You have the floor.
Thank you so much, Damid. So while listening to my fellow panelists, I'd like to take a different angle to respond to the question what exactly this is going to mean for the future generations, and also in terms of how we respond to this crisis and what this means for nature and what this means for our planet. I do believe that a strong connection does exist between human health and the overall health of our planet's ecosystems. Personally, I love watching films and documentaries that highlight the health of our planet. And I would tell you that every time I watch, I feel so much hope seeing the wonderful species of plants and animals. But the thought that they may all be gone soon and that our collapsing ecosystems are already escalating the impact of the health crisis and the climate crisis keep me wondering what exactly is stopping us all from changing our ways. And we are generally compromising the health and well-being of future generations through our actions and also our economic models. And you can clearly tell that we have greatly disrupted the human ecological balance. And it's very evident that the damage that we've done to our planet right now has continued to have direct impacts on human health. And we could even tell that from crises like the COVID-19 pandemic that we are in right now. And I always see nature as one of the forgotten solutions to climate change and the planetary health emergency. And that exactly is what we should be referring to it right now. And we definitely do need nature for survival, for health, and our well-being. And every time that humanity is at war, nature always strikes back. And that is why we end up facing and having to deal with so many impacts that are compromising the future generations. So what is happening to our planet today is saddening to my generation. We know that millions of species are at risk of extinction. Our waterways, our oceans, rivers, and the lakes are becoming a soup of poison flowing with plastic waste. And we're also seeing forests, acres being cleared everywhere. And of course, these challenges are going to have deeper consequences to our planet, and they're going to have deeper consequences also to our health as the entire human race. And the people that are going to be the most affected is going to be my generation, the young people, and especially because they'll have to live longer with the consequences of the world's inaction today, or the consequences of the world's wrong actions today. So it's clear that we need to make sure that we have this integrated approach to really move faster and make sure that we're addressing the humanity's challenges right now, because it's going to really be sad when generations that have not really contributed to the problem are the ones that have to clean up this mess. So I would say that my generation and all generations to come do deserve better. They deserve a livable world and a safe future. And it's not fair when a generation is left to clean up that mess that they did not even create themselves. So for me, I see a great solution in having this approach, because it's going to make sure that we give nature a chance. It's going to make sure that we even evade future challenges that may come in terms of how we treat our environment and in terms of how we treat the planet. And all of these things are going to be made possible if we first begin to give nature a chance by protecting, restoring, and also preserving and sustainably managing our ecosystems. So we have to respect the limits of the Earth's natural systems so that humanity can thrive. And I know one of my panelists mentioned about making sure that we focus on a strategy that also ensures that humanity and nature thrives. And I see planetary health as a key solution to prevent crises like the COVID-19, which means that if today the world chooses to focus on our planetary health, then we can even be better prepared for the next health crisis. And I think I'm just going to conclude by saying that our response to the COVID-19 pandemic right now has taught us some key lessons towards even fighting the crisis like the climate crisis. And even in the middle of a pandemic right now, the climate crisis is still affecting millions and millions of people out there around the world. It's not on a break, and people are really being affected. People are really suffering from this crisis, and it's up to us to just make sure that we are treating this crisis as it's supposed to be treated, and make sure that we are having this approach where we do not first focus on COVID and say we are going to deal with the climate crisis later. So these two things are affecting us at the same time. And it's also important to understand that as much as the crisis is affecting us, it's affecting us differently. There are people who remain the most vulnerable. There are people who remain, the most affected because they have a lesser capacity to adapt. As I'm speaking in my country also, I could tell that there are people that are really also having to be displaced and having to lose their lives from the impacts of this crisis. Schools reopened the other day in my country, and I know of some schools that had to be relocated to places because of places that are so flooded and the kids cannot cross over to their schools. The institutions have been submerged in these deep waters because the lake levels are also rising. So I do believe that even in the middle of this pandemic, we still need to treat every crisis that's supposed to be treated, and we still need to give attention to the climate crisis as well, and make sure that our actions today are focused on making sure that we leave this planet better than we found it. And I think it's always said that, of course, we have not, we've borrowed this planet from our children. And it's important that each and every person focuses on making sure that our actions today do not compromise how the future generations are going to live, and that we will all be mindful of how we live this planet for the next generations. So that to me exactly is what, using this approach we really mean for the next generations to come. Thank you very much.
Fantastic, thank you. That's wonderful, Elizabeth. And I think it brings us to a really good place in our program. With that, perspective from young people, and also giving some indication of how we need to approach this, how we need to approach the solutions. In terms of our time, we're running a little bit behind, so but I think we can make that work for us. So we're supposed to, at this point, have a short interaction of Q&A, and thank you for those who have posted questions already to us in the Q&A. And the panelists have been wonderful, and also I think in many cases have started to stray into the next part of the discussion. So people were not just talking about the problems, but we're also champing at the bit to start proposing approaches to deal with them. So in order to make that link and to respect the questions we're having coming in from the Q&A, what I'll do is I'll take one question from the Q&A, turn it back to the panelists. I'll pick on a couple of panelists to answer it. And then we'll go back to the we'll do another round of the panelists asking you to focus on the solutions. And if you would like to also address that question, then please feel free to do so in your responses. I would say that we have just about half an hour left on the program, so I'll be asking the panelists to be quite brief and punchy in terms of their next round of interventions, because then that will give us a chance to come back for further discussions. So the question that is shown up on the screen is from Thompson Goran, who's from SITE, and it's about how you best provide an enabling environment for children as change agents, including participation in decision making. There are other questions as well. There's a theme which is emerging in the Q&A about this issue of intergenerational impacts of COVID-19, all of the things we've heard from Zulfi, and also issues, including ones that Elizabeth touched on in her intervention, about even the mental health impacts of not only of COVID-19, but also the damage we're doing to our planet. So we need to try and take all of that and say, okay, how do we take seriously this issue about decision making that provides an enabling environment for children that allows them, if possible, to have an influence on those decisions, because we need to do more than just pay lip service to the fact that the decisions that are taken will impact on future generations. We have to be serious about taking that responsibility seriously. I won't for the moment turn back to Elizabeth as a youth representative, because I know that often one of the calls from youth is to say it should be down, it's don't pass the problem back to us. It's up to those who are already in power, who already have influence, to listen to the demands and say how they're going to respond to them. So I won't turn back to you yet, Elizabeth. We'll come back to you in a minute. But I would like to pass this over to Jamila in the first instance, because you're somebody who is directly an advisor to government. Taking these things into account, how do you build that into decision making at the national level? So over to you, Jamila.
On the role of children. Is that what you're saying?
Exactly. How do we take seriously that responsibility and engage them in the decision making?
No, I think that's a really important question. Children are not even seen during this pandemic. For me, my biggest worry is they're missing school and so forth. And I think we've got to leverage on, the ability for children to occupy the digital sort of social media space. I think we've got to create those opportunities for them to be heard. It's very interesting how I've seen civil society organizations, for example, engaging young people and getting them to raise their voice. And I think we've got to, as a government, I can't speak for the government, I'm just an advisor, but I would advise that you need to start creating those opportunities for young people's voices to be heard and curate those voices and listen to them very, very carefully. And we've seen this, just to give you one example, where young people, not exactly children, have created things like digital parliament. So while the parliament has its own seating, the younger generation are also creating a parallel digital parliament, talking about the same policy issues from a youth perspective. So I think we've just got to create those opportunities. And in today's world that is digital technology enabled, I think we've got to do that. There has to be political will, though, to listen.
Okay, fantastic. Thank you very much for that. I think, again, looking at the questions we've received, that is a very strong that is a very strong theme about these intergenerational impacts. So because we want to build on this and start moving on to the discussion about solutions, I'd like to ask the organizers please to put up the overarching question for the second part of the discussion. And then we'll go back with another round of interventions from the panelists. Because even before this, looking at the questions from the audience, people are asking what do they think will be the impact of COVID-19 on achievement of the Sustainable Development Goals, and also asking, can we point to one intervention or one approach which takes into account this syndemic nature, to be a little bit more targeted, to say, we all know that the SDGs are what we need to achieve. We know COVID-19 will set them back. Beyond just saying we need to achieve the SDGs, from each of your perspectives, what is one idea or two ideas that will come from your organization that will actually make this concrete in responding to COVID-19 and getting us back for real achievement of the 2030 agenda? So with that, I'll turn back to the panel once again. So I'll ask Mandeep, please, to lead us off again in this discussion. Over to you, Mandeep.
So for me, I think the answer is very much, we've heard it in all the presentations. We really need integrated solutions. We can't have sector-specific solutions anymore, because many of these challenges, crises, are multidimensional and they're interconnected and happening at the same time. So I think we need the syndemic analysis points us towards smart, integrated policy solutions that help us get to the multidimensional challenges and risks. That needs a systems approach. I think looking at, for example, climate and health and human health together, looking at the health of the environment and human health together, balancing that better, as is proposed through a planetary health approach, is probably a very good way of doing that. We look at UNDP, for example, at UNDP, we look at integrated solutions to help us drive progress on the SDGs. So, it's obvious we were off track on the SDGs anyway, and then COVID hit, so it's thrown us even further off track. So now we have to, with some urgency, look at what the evidence is telling us about the integrated solutions that are really going to drive impact. And I think one of the critical things is going to be governance. And there was something in the chat about, well, what kind of governance do we need? We need multi-sectoral governance. And being at WHO, Dermot, you will know that there's been a long discussion and history around addressing the social determinants or determinants of health, but it's often been stalled because we've only looked at it from a health sector view and engaged in the health sector, when actually we need to have a multi-sectoral approach to addressing multiple determinants. And I think be they environmental, commercial, political, social. So we need to think about crises like COVID in a similar fashion, I think. And that's what the syndemic approach is telling us, that we need to have multi-sectoral governance that helps us really invest in and drive forward the kinds of integrated solutions that many of the panelists have spoken to. And if I had to pick one right now, I would have to say addressing climate and health using planetary health approaches is the way that we are going to build forward better, have a green recovery from COVID-19. And I know WHO's got some really good principles on green recovery. And the best way to do that is using a planetary health approach. I'll stop there. Thanks.
Fantastic, thanks. That's wonderful, Mandeep. So I'll carry on then around the panel. Just for simplicity, we'll go in the same order that we went before. So I'll pass back to you, Jamila. Again, I think Mandeep has raised a really good point about the difficulty of intersectoral governance, at least at the UN level. As an advisor to the president, it will be also good to hear your your perspectives and your solutions or advice on how that can be taken forward, because you work with people that have to do this all the time. So over to you, please, Jamila.
I would say that we have to look at planetary health as a human security issue. And if it's a human security issue, then it needs to have, first of all, multi-sectoral engagement. And we've seen this, right, in the COVID pandemic, even in the response and so forth. People have come together in most countries in the world. I think people just come together to help each other. And I think the acknowledgement that it's a human security threat is something that's very important. The second thing is, even here in Malaysia, in my role now, we're talking already to governments in the region through ASEAN or others. And I think I've been listening to the Secretary General Antonio Guterres really making a very strong call for us to be able to take this to the corridors of power, where you discuss this as a human security issue that must be given a lot of attention. But governance itself, is just as much as it's in the governmental and top down. I think where the solutions, pandemics like this, and that all happen in communities, solutions are also in communities. We've got to also have a bottom-up approach.
Fantastic. Thank you very much, Jamila, for those comments. Zulfi, over to you, please.
Thank you very much. I think this is a question that most people are confronting right now, as to how can you innovate as you address some of these issues. And I'd like to suggest that this is actually a great opportunity to do something that we should have done anyway prior to this pandemic, which is to look at how do you make sure that you implement the Sustainable Development Goals in a multi-sectoral manner, with the integration and the accountability that comes with that process. And there was a lot of theoretical talk on this, which has now assumed an urgency of its own. In the context of what I spoke about, what this tells us very clearly is that we need much closer coordination between our health and education system when it comes to the outcomes related to children and adolescents. Also, a very important link to social protection programs, which generally have, to date, left adolescents and young people behind. Also, this is an opportunity to look at how, as you integrate and implement this, that you could also have greater monitoring and accountability. One of the big challenges in the early stages of the COVID pandemic in South Asia was the absolute lack of information for several weeks, in terms of even simple questions like what proportion of our educational institutions had adequate facilities to institute preventive measures such as hand washing, safe sanitation, etc. Those kind of things ought to be available in terms of dashboards to any health system, any education system, and importantly, at the point of service delivery in districts. These things ought to be a one-window operation. So what we are looking at now is how can one, with available resources, which are inevitably limited, but innovation has no cap, and therefore human thinking and looking at how we can restitute things a little better also means that we look at greater coordination at district levels between health, education, social protection, and importantly, nutrition. What we have found is that in many instances, the impact in terms of nutrition, sustainable food systems at district level has not been very closely integrated. And that's why in many places, what is emerging as a consequence of the mitigation measures is an absolute change in diets because of the availability of things in the immediate food environment. And that's got to change as we move forward, and can be done with limited resources, but with much greater intellectual input into putting things in place which we ought to be able to sustain afterwards. Thank you, Dermot.
Wonderful, thank you very much. And I think two of the points that I take from yours and also from Jamila's intervention are this positive approach, the fact that we've also learned things about solidarity within and between communities. And as you've just mentioned, Zulfi, the power of innovation, if we can harness it appropriately, and beyond just biomedical innovation, it has to be innovation in the way that we work across sectors and we govern these things.
Community, just to come back, community support structures and some phenomenal examples of women's groups working in this kind of an environment to bring things home in terms of homemade solutions. I mean, so one real remarkable thing that's been observed in some rural populations, certainly in rural Pakistan, where I have greater information, is how the communities got together in terms of addressing some of these priority issues, not with an eye of just a band-aid solution for the next month or two, things that they could do better moving forwards. So I think greater engagement at community level in terms of planning, in terms of developing things that are more sustainable, is something that we ought to keep our fingers on.
Wonderful. Thank you very much. Over to you, please, Monica.
So coming from the innovative sector, I couldn't help reinforce that medicines and diagnostic tests are only meaningful if they reach the people who need them, no matter where they live. And addressing these barriers to appropriate NCD treatments, or any treatment for that matter, requires collective action oriented towards developed targeted solutions. And let me give you two examples, the very tangible work that we have done in the past and that we are moving forward with to ensure that the innovation really reaches the people who need it the most, and not just by bringing medicines, but also in the innovative ways of delivering healthcare. So we are very proud of one of our partnerships. We call it Project Echo, which is one of the earliest applications of digital health technology, dating from as far as back as 2003. And since the start of the COVID-19 pandemic, it has gained enormous salience. Its model is active in 38 countries with over 800 programs up and running. And what does this project aim to do is to facilitate an equal uptake of medical innovation across the world to improve patients' health outcomes and reduce disparities in health and well-being between urban and rural populations. Further, it seeks to address the global gap of skilled healthcare providers for delivering quality oncology care through improving the skills of the frontline health workers, such as primary care doctors, nurses, and community health workers. And it uses an innovative tele-mentoring model that connects groups of community providers. I mean, the role of community participation has already been talked about. And with that, we connect them at centers of excellence in real time, collaborative sessions via video conferencing technology. These sessions, they help the local health workers gain the expertise required to deliver best in practice care to patients in their communities, and using digital technology to bring screening services into communities where people live, rather than have them trek the doctors' offices or medical centers, improve the rates of recovery. And this project is particularly relevant in COVID-19 context, as the pandemic is re-alerting the world to the need for strong primary healthcare system and the role of digital innovation in delivering quality care for patients is accelerating. And the global health community must accelerate the digital revolution in health, pursue community-based care models, and support data-driven health solutions in low and middle-income countries. And with quick collaborated action, we can save more lives from being taken by the syndemic. Thank you.
Wonderful. Thanks, Monica. And again, there are themes which are coming through, and one of these is this intervention, but not assuming that innovation is always something which is driven from the top down. It's also innovation about, for example, connecting and empowering communities. And that often this kind of intersectoral governance works well at a community level. There are a lot more successes there than sometimes we can show at the national or international level. So thank you for that. That was perfect. And please, Elizabeth.
Thank you so much. I'm going to highlight 3 things that I feel we need to give our priority to. Number 1, I believe we can have a green and just recovery if we focus on solutions that do not in any way breach our ecological boundaries. So it's time to change our relationship with nature. And we must also keep telling the truth about the climate crisis, because addressing the climate crisis is something that really needs to be given a priority. And I do believe that if we address the climate crisis and give priority to nature, then that can play an important role in preventing and mitigating the health crisis. And remember, while we have a vaccine for COVID, we don't have one for the climate crisis. So that is why it's really important for us to really address these issues in an integrated manner. Then the other thing, as someone who focuses a lot on green spaces, I can assure you that the COVID-19 pandemic has hit the cities hardest, and we've seen that a lot in most of the countries. But it is in these same cities where we can either win or lose the fight for a green recovery. So this calls for inclusion and also concerted efforts from all stakeholders in ensuring that the protection of our green spaces remain one of the main priorities towards a green recovery. And a green recovery to me also means a reduction in future pandemics, as well as bold climate action in the fight against the climate crisis. And the other last thing is that we need collective action. And this cannot be possible without meaningfully involving the children and the young people. And of course, the biggest question is, how do we involve them? So the children and the young people of today, despite the fact that they are the ones that are at the center of the challenges, they are still the same group that are stepping up and have decided to take leadership in addressing this crisis, stepping up to address the climate crisis, and stepping up to also demand for action in terms of how the crisis is being handled. So I do believe that we should begin to see young people as solution providers and not seeing them for the challenges that they do face. And by meaningfully engaging young people, I think we need to develop their internal capacities and also make sure that we listen to them, because the young people are speaking up. And of course, there's a lot of anxiety as well in terms of how the future is going to look like in the next years, because if not much action is happening right now and the impacts are escalating over time, then there's that fear that the young people are really going to be the ones that are going to be greatly affected. So we need collective action, and the young people are really showing and demonstrating leadership in terms of this. So we cannot afford to leave them behind if we are to achieve success in addressing the world challenges that we are facing today and the crisis as well. So it's important that we focus on this particular group. So for me, I think we must scale up environmental conservation and climate action and be considerate of how we will leave this planet for generations to come, and greatly involve the people that are at the center of these challenges, the people that are greatly affected, and the people that are also stepping up to ensure that they turn things around for the future. Thank you.
Thanks, Elizabeth. I think that's, in fact, it's a wonderful summary. And as I listen to the various interventions, different themes still keep coming up consistently. The need to protect nature, the need to build up from the community, the need to work cross-sectorally, the need to have accountability and governance and purpose in terms of how we manage innovation and so on. So I think we've got a wealth of convergent ideas that I think as a community we're going to have to work pretty fast to try and deploy them in time to shape hopefully the end of the COVID-19 pandemic as a pandemic, and to deploy them to genuinely to build back better. So we have about 10 minutes left on the program. We do have a few minutes, I think, that we can take for Q&As before coming back to a very brief conclusion. I'll just take a couple of the questions and to pitch them quickly to individual panelists and ask you for a quick response. Just one that's been raised for perhaps most relevantly for Mandeep. How do you see the impact of COVID-19 on the possibility of reaching the SDG targets? How worried should we be? Is it something that we just have to throw them out the window at this point and accept that they've been set back, or do you have a different approach to this? Over to you, Mandeep.
Thanks, Dermot. That's it's an important question. I mean, there's all kinds of evidence that COVID-19 has thrown us further off track on the 2030 SDG targets. But I don't think we should throw them out, because I think in the inherent design and logic of the SDGs is the solution to actually getting back on track and being better prepared to deal with future disruptions and crises. So what I was talking about earlier, the need for integrated approaches that balance people and planet, or balance people and the economy. I think this, it's underpinned a lot of what people have said today. So I think the inherent logic of the SDGs is the path as sort of the grounding for the solutions that we need. So I don't think we need to throw them out. I think we actually need to double down, and we need to be much more strategic and much, invest much more in rolling out the kinds of integrated solutions that will help us to deliver on the SDG targets. I'll stop there.
Okay, fantastic. So we keep the SDGs, we just have to work faster and more imaginatively to achieve them. Another question which I'll pose to Jamila, I'll rephrase it slightly. But the basis of this question is that the causes of our problems are both natural and human driven. So it's either degradation, of course, the natural environment, or problems that we have in managing them, or drivers inequity and so on. And if I had to put this a little bit provocatively, and as somebody who is an advisor to national government, what is the scope for making actors more accountable for damages that are caused and systemic problems that are the cause? In environmental health, it's a polluter pays principle, but it's broader than that. So over to you on that question, please.
I was hoping you asked me that because that's the one I wanted to answer. I think it's a mixture of having incentives and disincentives. I'll give you some concrete examples. We know, for example, during this COVID crisis, we know which are the industries badly hit, but we also know which are the polluters and which are the ones who are creating the environmental damage. So I think our central bank, has done something quite interesting. They've worked with the institute to research on the greenhouse gas emissions of the banking sector. So, and it's thrown a really, big spotlight on, even in the banking sector, they have to cut down their carbon. So there will be, obviously policies from the banks that you need to fulfill your certain ESGs, or in the Islamic finance sector, which is quite big here, also something they call value-based intermediation. So what are the incentives on, and at the same time disincentives for you to get loans and so forth if you don't have some of these measures to reduce greenhouse gases, for example, in your business. So that's one, the fiscal side. The other thing, of course, is that we have to look at the energy sector, the mobility sector. These are the biggest industries that contribute to environmental damage. So I think plantations and so forth. So I think it's about re-looking at business, recognizing that not only because it's important for the planet, but the Elizabeths of the world will demand this from us, and they need to speak up and challenge leadership on what they want for their future.
Wonderful. Thank you very much. Just as we have our eye on the end of the session, what I'm going to do is I'm going to put a question both to Zulfi and to Monica to briefly answer, and then turn to Elizabeth for the final word, because we are serious about intergenerational impacts and the voice of the next generation, to give her verdict basically on the discussions that we've had. And the question I'd like to pose is the one that's presented around the tools that we have around IHR and so on are not sufficient to the crisis that we face because of the determinants of the wide range of impacts, a wide range of determinants, but particularly in resource poor settings. Do we have to prioritize between different specific interventions, or is there a way in which we can work smarter on these more systemic determinants of health? So over to you, Zulfi.
That's a tough one, and it's not something which I think is solely pandemic specific. I mean, many of these social drivers and determinants of health have been staring us in the face. It's just that the pandemic has made it very clear to us as to what those discrepancies are, not just between countries, but within countries. I think some of the strongest evidence on the relationship of disparities with adverse outcomes, and particularly with long-term economic trajectories, is here from North America. So what I would say, Dermot, is that there is a tremendous opportunity now for looking at how we can rebuild things that we have actually begun to lose within this pandemic response. which is global solidarity around combined responses, putting in structures which are more global than national. So I'm concerned about vaccine nationalism and the fact that countries have looked after their own interests and haven't realized how interconnected the world is. I mean, this entire strategy of trying to block off borders in terms of containing the variants is makes ecological nonsense. I mean, viruses don't require passports to travel. And the history around this is that if you have something like this as a global outbreak, then it will affect every country of the world. So what does that mean in practical terms? It means that our response strategies have also got to be global. We should be looking at our weakest links. Our weakest links in this were the fact that even though IHR exists, the capacities at country levels to respond to some of these risks and challenges were very variable. One of the big reasons why the pandemic spread the way it did was that we just had not gamed the necessity for putting in some measures in terms of early detection, early responses in terms of identifying who the sources are, and some of those measures that needed to be put in place based on the best scientific evidence early enough. And by the time it was put in place, it was too late. The virus had already spread to so many geographies and countries. So I think this is a wake-up call because, as many people have said, this may be the first pandemic of this nature in this century, over the last 100 years since the Great Flu pandemic. But this certainly will not be the last one. The world has been lucky so far in that things like Ebola it's been possible to contain them. And it is almost certain that we will have other pandemics like this. And this has huge implications for putting in structures which are not based on just regulations, that are also based on building capacities in low and middle income countries. And I'd like to finish by just saying, Dermot, because of my own work on conflict settings and what we've been looking at, humanitarian context, at this point in time, as if it appears to many people who are looking at it from the outside, that the pandemic has spared many of these poor countries, the Somalias, the Yemens, the Malis of the world. And the truth couldn't be any different. I mean, the reality is that these countries have had similar impacts as in other LMICs. It's just that we have no information. We have no light in terms of understanding what's happening out there because there is no capacity. And this, I think, is a wake-up call to the world to say, you've got to build uniform capacity as best as possible in terms of diagnostics, in terms of response strategies, and in terms of strengthening national systems in addressing some of these growing threats of both pandemics of this nature and also antimicrobial resistance. Thank you.
Wonderful. Thank you, Zulfi. Over to you, Monica, please.
Sure. So I'll just add to what Dr. Zulfi has already mentioned. I completely agree that health cannot just be an agenda for one entity or one sector. Health is a political agenda. Health is a social agenda. Health is an economic agenda. And when we say all this, it also means that you cannot measure health only in the framework of, health frameworks that are already available like IHR, NGHS. It really took UN Secretary General to say that, let's come together and solve for this crisis, which means that there's so much that multilateral organizations can do. There's so much that private sector can bring in. Why not leverage the frameworks that are already existing, that have worked in the past for other sectors to be used in this particular let's say crisis as well, which also means that health should be raised not just at a national level, regional level, global level. We all need to work in solidarity in a standardized manner so that we do not have to solve for vaccine nationalism or fight for, vaccine being a public good or not. I think there's so much that private sector can bring in along with the multilateral organizations to put in the right frameworks in place where we measure on the economic growth of a country, the GDP spent on healthcare, and how can we really prioritize what needs to go in building a resilient health system and not a system which is already fragmented, and to say we have IHR in place. So what I'm trying to say, that this pandemic has really shown us that the existing frameworks have not worked. And perhaps we need to look in a more foresighted manner to see what is the way that we look at economic recovery in terms of delivering on healthcare. At the same time, call it a social and an economic and a political agenda at all levels of management. So, I mean, really, I don't have one size fit all solution to this, but I really urge that we could bring in all the experts from different domains and different sectors to come and build on some sort of, a universal framework for building more resilient health systems. Thank you.
Wonderful. Thank you very much, Monica. I realize just how difficult we're making it for the panel to say, give us the one answer to a systemic problem. And you're absolutely right. It isn't like that. I would say that, we've all been saying this stuff for a long time, but it's taken COVID-19 to really make it real. I think that it's really made very clear that we can't solve it as on an issue by issue, technology by technology basis. So with that, I'll hand over to Elizabeth for the final intervention in the panel discussion. Over to you, Elizabeth.
Thank you so much. I think a lot has been said in this discussion. We've shared a lot of solutions, and it's evident that we have all the solutions that we need to address the challenges that we are facing today. But I think I will just summarize and sum it up by reminding you that every day, every minute, and every hour that passes without urgent action translates to failing future generations. So we've been speaking up, and our message has always been very simple, and it's been act now. And of course, every promises that we've had, we are very grateful for every promise, every pledges, and all the things that we've been saying that we want to do. But I think that will not matter in the end if it does not translate to real action. So, and as we continue to speak up and share solutions and discuss about things that we want to do, it's good to remember that the impacts are still happening every day. We're talking about the climate crisis and discussing how we will address it. But at the same time, as we discuss, people are still suffering from the impact. We're talking about the COVID-19. We're talking about the planetary emergency. All the impacts are still happening each and every minute as we are making even these discussions. So it's important that you remember that this needs to be done urgently because time is running out and we need a safe future and we need a livable world. And of course, for us, we know that a safe future is not going to be possible if we do not get that livable world right now. So it's important that everybody takes up what they're supposed to do, and we remember that it's acting now and not postponing things for the future because the impacts are happening now and they're not waiting for us to plan. So we need to just move with urgency and make sure that we are being mindful of how we leave this planet for all generations and being mindful of putting people and our planet above profits. Thank you so much.
Wonderful. Thank you, Elizabeth. I think that is a really good final reminder. Those of us who work in this system are used to these discussions and having these aspirations and even making big plans and thinking most of the job is done. One of the most invigorating things I think that has come from youth engagement, particularly in recent years, is to listen to all of that and say, yeah, that's fine. It's not good enough until you actually do it. So I think that's the message that we should be taking away, including from your intervention. So that brings us to the end of the panel discussion. We're just a few minutes over time already, but if I can just impose on the organizers just to take a couple more minutes of time. There is one session which follows this, which is a synthesis and summary session, and in preparing for this, we started to get down some key messages that we wanted to take into that session. So I'll just very briefly report on them here. Just a couple of these points. I think it's been very clear from this discussion that COVID-19 as a health crisis has been massive, but the impacts that have come not directly through the infection itself are probably at least as large, probably larger than the impacts of the infection itself, particularly in those populations which are least served, and as Orpheus pointed out, least studied as well, or least studied where the information is worse, where the light is darkest, where we don't even really know in detail what is happening. We can also see a theme which has come through this discussion that these indirect impacts of COVID-19, although the infection itself appears to be mild amongst children and adolescents, that effect of COVID-19 on the system, exacerbating pre-existing problems, weaknesses in the system, are already having massive impacts and are likely to have intergenerational consequences as well. We're also hearing that from Elizabeth, who's pointing us back to the drivers of the climate and environmental crisis. And one of the messages I've taken away from this is that we can't allow COVID-19 to distract us from those underlying issues. Instead, it's the core that we need to tackle them as part of the same problem, and to look at those affecting those drivers of environmental degradation, inequities, and so on. And also that the goal of universal healthcare or universal health coverage can't wait. These other issues can't sit on the sidelines until we have time to fix them after we've fixed COVID-19. That we need to build the system as a whole. So that's sort of our first draft of the problem side of the equation. And then on the next slide, we could start to look at the systemic solutions to this. And this involves both taking a broad mindset, but also being serious about the parts of the community that we engage in this. This isn't something that just gets decided at national level, even less only gets decided at international level. It's something where we have to take populations with us and work all the way down to the community level. So we need to reset our approach to health security. If we're thinking about COVID-19 as a pandemic, it needs to be connected to universal health coverage and also the health determinants, going all the way up to the drivers of the climate crisis. So the planetary health approach is an appropriate one to take here. We also, as we've said, have to take a synergistic approach where government, citizens, private sector, and civil society work together for preparedness. But it's beyond preparedness. It's more generally for the health of people, families, and the planet. We've also heard quite a lot about innovation, but it has to be innovation with a purpose. As I've said, the scientific innovation in responding to COVID-19 has been amazing. It's been unprecedented. But unless we start to find innovative approaches to deliver those solutions to those which are unserved, then we're not helping those populations, and we may just be exacerbating tensions. The issue of vaccine nationalism is one that I think is very relevant here. There is also, finally, a real opportunity, and it's the one that Elizabeth, I think, has been imploring us to take, that the rethink that we're having to have because of COVID-19, including the size of the political and economic investment, so the size of the political decisions, but the trillions of dollars that are going into resuscitating economies after COVID-19, are probably the only opportunity we will have in the next generation to rebalance in favor of sustainable development. So, for example, if economic rescue packages go in favor of propping up fossil fuel industries, then we will probably blown our carbon budget for the future, and that simply can't happen. And the next few months, next year or so, are our opportunity to address those kinds of issues. So those are the first draft of the conclusions that we'll be taking into the final session, but we'll be elaborating on them based on this discussion and all of the questions that we've received. So with that, it just remains for me to thank the panelists for what I think has been a phenomenal discussion on a really wide-ranging and difficult and challenging but essential set of questions. To thank the organisers, the organisation of the PMAC conference is always incredible. The support behind the scenes is phenomenally efficient. And also to particularly to thank those of you who have tuned in for this session and for the previous sessions. So thanks once again to all of you. And if you also have enjoyed the session as much as I have, then please do fill in the poll, the evaluation of the webinar. And with that, I'll thank you all and wish you a good evening, afternoon, morning, wherever you are in the world. Thank you very much.